How can we ethically overcome vaccine hesitancy? Imagine a world where everyone feels confident about vaccines and public health is stronger than ever. That's the goal when we look at how to ethically address vaccine hesitancy. It's a challenge that touches on core principles of medical ethics: autonomy, beneficence, non-maleficence, and justice. These principles guide us to respect individual choices while protecting community health. Respecting autonomy means engaging in honest conversations, not just telling people what to do. Healthcare providers should listen carefully to concerns and ask questions to understand where hesitancy comes from. Using participatory questions like, "What worries you about the vaccine?" helps build trust. When providers use language that invites dialogue instead of making assumptions, fewer parents resist vaccination. It's about recognizing that most people want to do what's best but need reassurance and clear information. Beneficence pushes us to act in the best interests of individuals and communities. This means tailoring messages to specific groups. For example, some communities may distrust medical systems due to past experiences. Engaging trusted community leaders or health workers from those communities can make a big difference. Using local languages, culturally relevant stories, and community events help spread accurate information. Educational campaigns through social media, flyers, or community meetings can correct misconceptions and address fears directly. Offering small incentives like certificates or free health checkups can also motivate people to get vaccinated, as long as it's done ethically and transparently. Non-maleficence is about avoiding harm. Transparent communication about vaccine safety is key. Healthcare professionals should openly discuss potential side effects and how rare serious adverse reactions are. Sharing stories from parents or community members who have vaccinated their children can help others see that vaccines are safe. When people see others they trust getting vaccinated without issues, their fears lessen. Proper training for healthcare workers on how to listen empathetically and answer questions honestly is essential. This builds trust and reduces misinformation. Justice means making sure everyone has fair access to vaccines. Some groups face barriers like cost, transportation, or language differences. Addressing these barriers ensures that no one is left behind. Mobile clinics, community vaccination drives, and multilingual information help reach underserved populations. Training healthcare workers to handle hesitancy respectfully across diverse communities aligns with justice. It's about meeting people where they are and respecting their cultural backgrounds. Finally, dialogue is a powerful tool. Engaging community leaders, religious figures, and social media influencers can help spread positive messages about vaccines. Listening to concerns early and addressing them before they grow into bigger problems is part of ethical responsibility. Healthcare providers need ongoing training to communicate effectively and confidently. When people feel heard and respected, they are more likely to consider vaccination. In the end, overcoming vaccine hesitancy ethically isn't about forcing people to vaccinate. It's about creating a respectful environment where informed choices are supported. When we combine honest communication, community engagement, and fair access, we build trust and strengthen public health for everyone.